Welcome back to our next session on preventive measures. And today we have with us Dr. Rahul, who's going to be addressing cardiovascular disease in chronic kidney disease. On to Dr. Rahul.
Thank you so much, Marianne. Thank you for inviting me to speak on this very important topic in today's world. So I'm a cardiologist based in Pune, and I mainly focus on interventions or coronary artery, and my focus has been cardiovascular disease and especially heart attack. So let me begin my presentation. I'm just going to share my screen with you. So is the screen visible now?
Yes.
Thank you. So that's where the heart is located, and the heart is going to pump the blood all around the body, and it's going to perfuse all the vital organs, including kidney. So heart and kidney have a very close relation. They work independently, but they are very dependent on each other. So if cardiological problems happen, kidney problems are likely to happen. And if there are kidney problems, then cardiology problems are going to happen. Just for example, if the heart pumping goes down, what we call a heart failure, your kidney, even if it's normal, it's going to go down and the patient is going to have a kidney failure. If the patient has a kidney disease, for example, somebody is having a renal failure, they are on a dialysis, they all are going to develop vascular disease. So they are going to develop atherosclerosis, that is blockages in the blood vessels of the heart and other parts of the body, and that's going to lead to heart attacks and heart failure. So cardiovascular disease is the leading cause of death globally. As recently people got worried about corona. For us cardiologists, cardiovascular disease has been our main killer for a number of years now. There are around 17.9 million people dying from CVD almost every year, and this represents around 32% of all global deaths. Of these deaths, 85% are due to heart attacks and stroke, what constitutes the main component of CVD. And over the last 3/4 of CVD deaths taken place in low and middle income countries. So India, Brazil, Russia, China, and all these developing countries, BRIC countries and countries with a poor socioeconomic status, they are the actually people who are bearing the brunt of this CVD. Out of these 17 million premature deaths under the age of 70 due to non-communicable diseases in 2019, 38% were caused by CVDs. So CVD is our main target, and as a cardiologist, as a nephrologist, diabetologist, we want to get down this number of cardiovascular disease around the world. So we'll go through what are the causes of cardiovascular disease and how we can alter the course of CVD over a period of time. So there are two factors. One is modifiable risk factors and others are non-modifiable risk factors. So if you look at the modifiable risk factors, which are tobacco use, unhealthy diet, obesity, physical inactivity, harmful use of alcohol, these are the modifiable risk factors which we can easily modify. And there are some factors which are non-modifiable, which are basically patients' genetic makeup, race, like patients who are from the South Asian race, they are more likely to develop coronary and cardiovascular disease compared to Caucasian or Afro-Caribbean population. So why this is all very important is because we want to detect cardiovascular disease as early. Always give an example. If somebody develops a breast cancer, the stage 1, we pick it up, we can completely cure the breast cancer. But if some patient lands up with breast cancer in stage 4, then we cannot treat that or cure that disease completely. So same thing with cardiovascular disease. If you pick up the blockages, cholesterol problems, diabetes early, you can modify the course and you can have a meaningful impact on the patient's lives. Patients are going to live longer. So these data is taken from recent WHO website, and this is what is going to happen going forward in the next decade and further. So I believe next couple of decades are very crucial for people like us in India, where cardiovascular disease is on significant rise. So what is CVD? CVD constitutes of different components. As I said, heart disease, that is cardiovascular disease, involves mainly heart attacks and strokes, which is basically blockages of the blood vessels around the heart. Then it is not only the coronary arteries and the cerebral arteries, but also arteries around the body, that is arteries supplying the kidneys, arteries supplying the legs, they all get disease, and it's called peripheral arterial disease. Rheumatic heart disease, which is damage to the heart muscle and the heart valve from the rheumatic fever, is caused by a streptococcal infection. And I worked in America and England. Almost rheumatic heart disease is gone out of the window. And the reason for that is they have eliminated these overcrowded spaces. They are asking people to live in a very organized manner, and that's why they don't have rheumatic heart disease now. So going forward, if we manage our population and their hygiene very well, we can eliminate rheumatic heart disease. Congenital heart defects like ASD defects, like holes in the heart, they are there from the birth, and this can be also improved by improving nutrition of the mother and nutrition of the family. So if you improve the nutrition, heart defects will go down. For example, if you give them folic acid, B complexes, good diet, their holes in the heart, the developmental defects are going to go down. Brief vein thrombosis and pulmonary embolism, this has gone up enormously due to COVID situation. Also, as you see, the B12 deficiency is a very common problem in Indian population. There are a number of factors for that, and B12 deficiency is one of the leading cause for development of a clotting problem in the heart and lungs and lower limb vessels, especially venous circulation. So what are the common attacks, the heart attack signs and symptoms? So basically, patient presents with chest pain, heaviness, discomfort around the chest area. People think that it's only the chest, on the left side of the chest, which is causing the problem. No, it can be your right side of the chest, it can be your back, it can be the jaw, it can be the both arms which can get the pain, not only the left arm. You can have pain in the right arm, and usually we call it a pain. The patient doesn't perceive it as a pain. Patient perceives it as a discomfort, uncomfortable feeling, and that's why patient will present to you many times. So many times they will ignore that. They will think it's acidity or some muscle has sprained and they don't need to come to the doctor. But most important thing is, if you have a chest discomfort, if you have breathing difficulty, then you should attend your physician, nearest emergency department, and get your ECG checked, get yourself checked by a cardiologist or a physician. Other problems can be breathing trouble. Patient complains of breathlessness. Now, many times, if you are a kidney patient, you may not understand why you're breathless, whether it's a fluid in your body which is causing breathlessness, or whether it's a new problem like a heart failure or retention of fluid because of poor pumping of the heart, that is causing a heart failure or breathlessness, or whether you have a heart attack and that's causing breathlessness. So whenever you develop breathlessness, which is out of proportion to what your usual status is, or you are not being breathless at all and now you're getting breathless, then it's a time to attend emergency department or the physician's clinic. So these are the important symptoms. Other symptoms, patient can complain of palpitations, patient can complain of sudden episode of collapse. They may get dry cough at times, or coughing at night, or they may have very much like a bad acidity. And these are the symptoms you should go to your heart doctor and get yourself checked. As I mentioned, there are two types of risk factors. One is non-modifiable risk factors and modifiable risk factors. So what do you mean by non-modifiable? Non-modifiable factors are age. We all are aging every day. And as our age increases, we are more likely to have cardiovascular disease. And obviously, age cannot be stopped. Second thing is gender. If you are a man, you're more likely to have heart and vascular disease compared to women. And the reason for that is women have different sex hormones compared to men. And male hormone, that is testosterone, makes you more prone to develop CVD compared to women's hormones, that is estrogen and progesterone. So woman is protected until she achieves a menopause. After menopause, the risk for the woman starts going up, but actually it never catches up, because that period of from around 13, 14 years of a woman's age till 50, 45, 50 years of a woman's age is protected from the cardiovascular disease. That's why you will see less incidence of heart attack in women. However, this can be different if a person is suffering from a disease like diabetes or kidney disease, where these factors are leading to high incidence of cardiovascular disease. Genetic factors, as I mentioned, that if your father or mother developed a coronary artery disease or CKD early in their age, they are more likely to have, that family person is more likely to have cardiovascular disease. Race and ethnicity, as I already mentioned, we as a South Asian are more likely to have cardiovascular disease compared to our Caucasian and Afro-Caribbean colleagues. What are the modifiable risk factors? These are the factors we can definitely change by bringing on change in our lifestyle, our medication. So high blood pressure, hypertension, very easy to treat, but very neglected by the population because it's a silent killer. You don't get any symptoms, and people think that they don't have any symptoms, so they don't have to worry. However, high blood pressure is an important parameter which is leading to kidney problems. And as I mentioned, that if you have a high blood pressure, you're going to get a kidney failure. If you have a kidney failure, you're going to get a high blood pressure. So high blood pressure and kidney are very closely linked. So whenever you are diagnosed with high blood pressure, treat it. Treat it with medication. Get your blood pressure under control. As many of you are dealing with kidney patients, it's very difficult to control the blood pressure in kidney patients. Obviously, there are a number of scientific reasons for that, but whatever it is, get the blood pressure under control. The target is 120 by 80. We will accept anything about 130 by 85, 90, okay, but 140 by 90, above that, we will not accept it. We have to treat it. Second factor is smoking. Smoking has gone down compared to what it was in 1980s and 90s because people are getting more aware, and there is a public ban on smoking all around the world, and that has led to important change in the public mentality. Smoking is going down. However, we need to continue our war against these modifiable risk factors. Third factor is diabetes. Diabetes is on the significant rise. India is diabetes capital of the world. And as I practice in my clinic, I have a machine to check somebody is diabetic or not. We check HbA1c. And I am really started to see number of young people having diabetes, which is a very bad news for South Asian population or Indian population here. And we need to be making people very aware. They should start their physical activity. Why people are developing diabetes is they are inactive. Many of our friends here are working in service industry. They are providing support. They're working in software industry. They are having armchair jobs, and they're not performing any activity, and that's leading to rise in sugar. Second factor is they're having diet which is rich in carbohydrates. Everything is easily available, everything is relatively cheaper, and they can afford to eat carbs and sweets very easily compared to what it was in 1980s or 1970s. So the activity has gone down, carbs have gone up, and that is leading to increase in diabetes. As such, South Asian people are more likely to develop diabetes anyways compared to other population. Obesity has gone up because of all these factors, and cholesterol has gone up because of all these factors. So what are the risk factors for development of heart disease or CVD? As I mentioned, diabetes, high blood pressure, being overweight, smoking, high cholesterol, and family history. These are the very important factors for development of cardiovascular disease. Risk of smoking and risk of physical inactivity is same. So physical inactivity is as bad as smoking. A few words about hypertension. Hypertension, we do a lot of campaign. If you see our Insta page or YouTube page, you'll find a lot of our activities are focused on controlling blood pressure or raising awareness about blood pressure. Why? Hypertension is very easy to diagnose. Within 2 minutes, you can diagnose somebody's high blood pressure. Obviously, you need to follow them up very regularly, but you just need a simple machine, which is automated machine with a battery operated, and you just check somebody's blood pressure, you can diagnose the blood pressure. High blood pressure leads to, as I said, most importantly, kidney failure. A lot of population is having kidney failure as a result of uncontrolled high blood pressure. High blood pressure also leads to blindness, strokes, arteriosclerosis of the blood vessels, heart attacks, and heart failure. And that's why it's very important to diagnose and treat high blood pressure. Very simple intervention. about 1 billion of the population suffers from hypertension, and around 50% of them do not know that they have hypertension. There's a lot of scope for intervention in this arena. What happens with progressive decline in kidney function? As you know that the kidney disease is a gradually progressive disease. Even if we don't have a kidney disease, as you know that we all age, and as we age, our GFR, that's a measure of kidney function, glomerular filtration rate, starts dropping. And as a person starts progressing and developing end-stage renal disease, there are a lot of problems when a patient develops an end-stage renal disease. They will go on a dialysis, and when the patient goes on dialysis, there's so much change in their body fluid volume. There's so much change at the cellular level. Patient develops a myocardial fibrosis. So the cells in the heart muscle are getting replaced by a fibrous tissue. They develop rhythm disturbances. You'll see that these lot of kidney patients have got a extra beats coming, and sometimes may develop a bad rhythm disturbances called ventricular tachycardia. A lot of these patients will develop a sudden cardiac death, and I'll go to the next slide for that. There is an increased cardiovascular mortality. So as the GFR declines, the cardiovascular disease increases significantly. So this is a slide which is showing, this is taken from a journal called Circulation, a very high impact journal. As you can see that GFR, which is less than 60, which is estimated glomerular functional rate, filtration rate is less than 60, your cardiovascular events are much higher. Cardiovascular death, all-cause mortality is much higher compared to GFR more than 60. Again, same thing, if you have a sudden stage of the kidney dysfunction, if you see the patients on end-stage renal disease on hemodialysis, sudden cardiac death is very high in patients with ESRD on hemodialysis compared to the patients with higher GFRs. Okay, same with other problems like death, cardiac, non-sudden, non-cardiac deaths. If you look at the sudden deaths go very high in these patients on dialysis. I'm going to speak about food. So what is happening, if you see recent publications from 2018, 2019 onwards, there's a lot of talk about ultra-processed food and increase in the cardiovascular disease. So in countries like especially United States, UK, Europe, the developed countries, they are relying more on ultra-processed foods. And what are these ultra-processed foods? These are the foods, these are derived from food or parts of the foods, and they're being added cosmetic food additives and not used in culinary. So just example, breast milk substitutes, breast milk formulas, infant formulas, cookies, which most of us are eating cookies, ice creams, shakes, ready to eat meals. You know, nobody has time to cook these days, and they will go and eat ready to eat meals in especially US and UK. At least in India, there's a lot of manpower, so you can still buy a tiffin, which is a home cooked food, which is much better than buying a ready-made, ready-to-eat meals. Soft drinks, huge number of outlets, you will see the soft drinks, and soft drinks are the worst product for development of the cardiovascular disease. Sugary drinks, hamburgers, nuggets, all these things are into ultra-processed. What we are supposed to eat is this simple food: legumes, vegetables, fruits, starchy roots and tubers and grains, nuts, beefs, yolks, eggs, chicken, milk. So this is what we all are supposed to eat. And what we have moved is developed countries and India as well, we are moving towards ultra processed food. So I think we should bring on a change in our population's behavior, and they should start avoiding ultra processed food. So I think that is something we have to focus on. Things which we will always use is salt, sugar, vegetables, oil, butter. These are essential parts of cooking. However, we should limit the use of these products when we are cooking. So we should have a low salt diet, we should avoid sugar, we should avoid vegetable oils, and use a minimal oil whenever it's required. So these are the very important factors. Processed foods, a lot of people are relying on bread, salt solutions, meat in salt solution. They will use as a preservative. Fruits in syrup, canned fruits are increasing. Bread and cheese are being used every day by most of the households, and that's going to increase to cardiovascular disease. I worked in United States and New York, and this is what we used to eat, regularly for breakfast. This will be so easily available, and it looks so good and yummy, and we all want to eat it. But the long-term results are devastating. especially when you are not exercising and not doing any activity, and having this kind of food is invitation for shortening your life and ending up in the ICU and dying. So that's about it.